Hi, my name's Sunita Noom, and I am doing my persuasive speech. Um, I worked as a secretary in a doctor's office, answering phones and booking appointments. One day, I got a call from a 23-year-old woman, and she said she was doing a breast self-examination in the shower, like she did every month, and she thought she felt a lump in her breast. I immediately scheduled an appointment for her to see the doctor. My thought, like probably most people, was that she was too young to have breast cancer and that she had nothing to worry about. Once the doctor was done examining her, he had me schedule a mammogram and an ultrasound because he felt the lump too. After the tests were completed, the mammogram, the ultrasound, and also a breast biopsy, it confirmed that she had breast cancer. In Sean Gasky and Joan Nicholsky's article, "Are breast self-exams or clinical exams effective for screening for breast cancer?" they state that breast self-examination had little or no impact on breast cancer mortality and cannot be recommended for screening. And I began thinking, does this mean that breast self-exam did not impact this 23-year-old's life? I believe that even if the statistical findings do not support or recommend breast self-exams, when one person's life is saved, it's worth taking the time. What if that young woman had not performed her breast self-exam? Maybe she would not have found the lump until her next physical examination. Would it have been soon enough? As Mr. Gasky and Ms. Nicholsky's article also states, 1 in 8 women will be diagnosed with breast cancer, and 1 in 30 will die from it. Are you willing to take the chance of not being that one person who finds their breast cancer during a self-breast exam? Knowing that breast cancer, an insidious disease, could be detected by a self-breast examination and save the life of at least one person, I recommend that everyone should learn how to perform them accurately. I am here today to explain why I think it's important and encourage women to perform them regularly. According to Sharon Lewis of Medical Surgical Nursing, Assessment and Management of Clinical Problems, breast cancer is the most common malignant cancer in American women. It is only second to lung cancer and is the leading cause of death in women. Over 230,000 new cases of invasive breast cancer are diagnosed annually, and approximately 39,000 deaths occur each year related to breast cancer. 410 of these are men. The incidence of breast cancer is slowly decreasing, with only a slight drop associated with the disease. The decline may be a result of the decreased use of hormone therapy after menopause, which is a risk factor. There are approximately 2.6 million women alive in the United States today who are breast cancer survivors. Patients diagnosed with breast cancer with no spreading to the tissue under their arms have a 5-year survival rate of 98%, as opposed to patients diagnosed with advanced stage breast cancer having a survival rate of 23% after 5 years. This information further bolsters the argument that early detection is the key to survival of this disease. The cause of breast cancer isn't fully understood, but there are well-known lists of risk factors for this disease. The risk factors seem to be cumulative and interactive, which means multiple risk factors increase the risk for being diagnosed with breast cancer. Breast cancer has a genetic component with the BRCA1 gene, which can be tested for. Amongst women, the highest incidence of breast cancer is in women above the age of 60 who have a long menstrual history, meaning they started menstruating before the age of 12. The Women Healthcare Initiative study shows that the use of combined hormone therapy, which includes birth control pills increases the risk of breast cancer and the risk of having a larger, more advanced breast cancer at diagnosis. Risk factors that women and men have control over are excess weight gain during adulthood, sedentary lifestyle, smoking, dietary fat intake, and alcohol intake. If you have any of the risk factors listed, the incidence of getting breast cancer is increased. Therefore, I am using this forum to encourage women and men to perform breast self-examinations. Many women think they are too young to have to worry about the disease. That is why I told the story earlier of this 23-year-old woman. Age is only one risk factor for getting breast cancer, and it is important for women and men to know their body. The repetition of doing a breast exam every month makes a person aware of any small changes. It allows you to hear your body when you are sick. I believe it is important to perform breast examinations even if the medical community disagrees. According to numerous sources, breast self-examinations are not generally recommended by the medical personnel as a whole, because women do not know how to perform breast exams properly, and they also get a lot of false positive results. But I believe that the benefit of performing a breast self-exam outweighs any risk that is involved. It costs nothing to perform a breast self-exam. It is a non-invasive procedure that can be performed in the privacy of one's own home, and it allows people to take control of their own health care. A woman performing a breast self-exam properly can find a mass earlier than waiting to see a medical professional. It is an important factor in doing a breast self-exam is the education to do it correctly. Have a medical professional instruct you how to do it. In the Sharon Lewis book, Medical and Surgical Nursing, there's a chart that explains on how to do it. And it says to look at your breasts in the mirror while you're topless and examine them and see if you see any masses or any dimples, because they should be even, the skin should be even looking. And then lay down on your back with one hand above your head, like this, but down on your back. Using your other hand, you palpate or rub the breasts evenly using different pressure and go up and down, and make sure you cover all areas of the breast, including under your arm. It's easier if you do this in the shower. If you find anything unusual, you immediately report it to your doctor. And you can also look online for videos and charts, and I'm sure a medical professional also has pamphlets. You should also do it at the same time every month. So mark your calendar to keep a schedule. It is important to do it at the same time so you can see any changes from month to month. And according to Lewis again of the Medical and Surgical Nursing, you should avoid the time of breast changes, which is during menstruation and ovulation, because the breast tissue is may be sore or tender, and the breasts may also have abnormal changes like masses due to hormonal changes. So in conclusion, breast self-examination is appealing as a patient-centered, inexpensive, non-invasive procedure that empowers women and is universally available. If a simple procedure that is done in the privacy of your own home, it costs nothing and can save you money, why would you not take the opportunity and the time every month to save your own life. Thank you.